Good afternoon, everyone, and welcome to the August Food Security Community Call. I'm Anne Marie Hart Bookbinder, the Food Security Programs Manager at the Montgomery County Food Council, and I am joined by Danielle Wogu, AmeriCorps Vista, and possibly some other members of the Food Council staff. We are recording today's call as usual. And today we are going to have a brief update on the strategic plan to end childhood hunger. We're going to discuss and engage on the latest data from Maryland Hunger Solutions and the Capital Area Food Bank relating to food insecurity in Montgomery County. We're going to have a community conversation about challenges relating to funding and share some other related announcements and resources. And I am going to take a few quick moments here for a brief Food Council policy update. And then I'm going to turn things over to Deanna Tatau to share some information about some grants. So I believe that Danielle is going to add the agenda to the chat. So you will have that as we move along. All right. So as many of you know, the White House is hosting a conference on hunger, health, and nutrition, focusing on ending hunger, improving nutrition, improving physical activity, reducing diet-related disease, and closing disparity gaps by 2030. In response to a call for input, the Food Council authored a letter to the White House detailing our top priorities in the food system for the federal government to address, the content of which was conceived in collaboration with our Food Security Community Advisory Board. And we're going to put a copy of that letter in the chat. The Food Council also signed on to a letter penned by the Better Buses Coalition addressed to the Montgomery County Department of Transportation in response to their ongoing role on Ride On Reimagined study outreach strategies. The letter details suggestions for the county to create a Ride On ambassador program, partner with existing community organizations, and conduct on-bus outreach to riders. And I'm sorry, I'm just going to take a pause for a second while I let some more folks in from our waiting room. We also signed onto the NANA Coalition's letter to urge the U.S. Senate to include critical child nutrition investments in the upcoming reconciliation package known as the Inflation Reduction Act of 2022. To ensure children maintain access to nutritious meals. And again, we will have copies of all of those letters shared in the chat and in the resource email that goes out tomorrow, should you like to take a look at those. I did also want to mention that the Montgomery County Council formally recognized the Food Council for its 10-year anniversary. We are incredibly grateful to the county for its support of our work and are excited to continue working toward a more equitable and sustainable food system for decades more to come. Wanted to share that the Food Council is recruiting new council members and a new members for the board of directors. To apply to serve a 2-year term from January 2023 until December 2024, please complete our Google form, including uploading a resume or CV and a personal statement by Wednesday, August 31st. We're also going to share more information about where you can learn about Food Council membership, a place on our website where you can find out more, and you can contact Beza of our staff with any questions, and we will put her email address in the chat. A few updates relating to MCPS school meals. First, I did want to note that online FARMS applications are now available. They are open for parents to complete and submit for the 2022-2023 school year for free and reduced price meals. I cannot stress enough how important getting families to complete these forms are, because as many of you know, the federal government did not extend the waiver to provide free school meals to all students as it has been doing during COVID. So this is really a crucial time to get families connected to this resource and have 5 fewer meals to worry about providing their families, for their children for lunch during the week. So we are sharing the link to that in the chat. Translations in other languages are available through the online application. And there are how-to videos for the online application in English and Spanish that can also be shared with families who need assistance. And again, we will include those in the chat. And lastly, MCPS this coming Friday, August 12th, and the following Friday, August 19th, will be providing bulk meal kits to children under the age of 18. And they will distribute boxes at designated locations from 10 a.m. to 12 p.m. We will include the list of locations in the chat and in our resource email. But just to keep in mind that boxes will be available on a first come, first serve basis. They will provide a total of 5 breakfasts and 5 lunches. And they are only for students who are not participating in in-person meals. And there is a form for parents or guardians to submit for bulk meal pickup consent. All right, I'm going to turn things over now to Diana Tatau.
Hello, everyone. Thank you, Anne-Marie. I have some good news. I'm very excited to share with everyone that the Community Food Rescue Mini Grants Competition is back for fiscal year 23. We took a break during the pandemic. These mini grants are a collaboration of MANA, the Department of Health and Human Services, and the Montgomery County Food Council. This grant process is managed by the Department of Health and Human Services and the Montgomery County Food Council. And these grants are intended to provide opportunities for improving the capacity and infrastructure of the local food system in all aspects involved in food recovery, and also for inventive, innovative, and collaborative approaches to reducing food insecurity. At this point, our portal for application is not ready, but it will be ready on August 15, so that partners can start submitting applications at that time. For anyone who needs assistance, we will have also a pre-application technical assistance conference that will be on August 22nd, and all the applications will be due in the system by Friday, September 9 at 7 p.m. All of this information will be in the portal. What I will do is I will share the link with all of you right now, but just keep in mind that it's not updated. The information in the link right now is for our 2019 grants, but the same link will be updated August 15 with all the new information. The funding criteria, the grants will range from $2,000 to $10,000. That's what they're called, mini grants. That is all I have right now, unless I miss anything, Anne-Marie or Cheryl, that you think is important to share. And I will drop the link in the chat. Please check back on that link on August 15. Thank you.
Thanks so much, Diana. I am going to turn things over now to Danielle to share a brief update on the strategic plan to end childhood hunger.
Hi, everyone. So as we shared on the last FSC call, the Food Council has been asked by County Council President Albonaz and the Department of Human Services to act as a project manager for the creation of the county strategic plan to end childhood hunger. We have identified 6 major intervention pathways through which children experiencing hunger are reached, including emergency food access, community food distribution, benefits, school-based, out-of-school, early childhood, and healthcare. We are engaging stakeholders, subject matter experts, and policymakers in strategic brainstorming groups for each of these intervention pathways. And we appreciate that many of you have expressed your interest in contributing to this work. These groups have already hosted their first meeting, and their second round starts again this week with benefits and healthcare groups, and the rest of the groups following in 2 weeks after that. I will say them now. I'll say them now, but I will also put them in the chat. I will put them and the dates in the chat, so you can always and you can always find more information on our websites. So we have healthcare, which is happening Tuesday, August 9th That's the one that's happening tomorrow from 12 to 2. We have benefits on Thursday, August 11th from 1 to 3. We have emergency food access and community food distribution, which is happening August 15th from 2 to 4. Then we have early childhood, which is happening August 15th, the week of August 15th. The date will soon be finalized. Then we have early childhood strategic brainstorming group, which is the same week, August 15th. The exact dates will be finalized soon. Out of school, which is happening the week of August 22nd, and school-based, which is also happening the week of August 2nd. And like I said, you can find more information on our website, mocofoodcouncil.org/childhood hunger. If you have not already shared your interest in joining one of these groups, please let us know by completing the form that we will post in the chat, or by emailing me, and we'll get you connected. You can email me or Anne Marie. My email is Danielle@mocofoodcouncil.org, and Anne Marie's is annemarie@mocofoodcouncil.org. Oh, sorry, there's a little more. My bad. Resident engagement of households with children experiencing food insecurity will occur later in August and September to gather community insight on how they are currently engaging with existing programs and resources, and where there are opportunities for expansion, improvements, and new solutions. This will capture qualitative feedback via an online survey in both English and Spanish, with the goal of reaching 500 participants, and qualitative feedback from hosting 3 listening sessions that will include a minimum of 10 residents each. We will be reaching out soon to ask for your assistance in connecting these residents to these opportunities and to share their feedback.
Thanks, Danielle. I know that many of you have already been participating in some of these calls, and I see that some of you are here today. And I just wanted to offer the opportunity, if anyone has been a part of one of the brainstorming groups and just wanted to share a thought or two as to what they thought about the process, what they thought about the conversations, the experience and kind of hearing from other stakeholders, subject matter experts, policy folks who are in those calls. I just wanted to open this space for you to feel free to share that. So. I'm trying to be comfortable with the quiet these days. Make sure I'm giving everyone a chance to speak. It always feels so much longer on Zoom than it does in any other format. Please, Julia.
Sure, I can hop in and say something. So I've been a part of the out of school time and also school-based groups the first session, and just wanted to say that I think we at Maryland Hunger Solutions always really appreciate when there are a lot of people from different sectors and experts who kind of focus on different pieces of these programs together in a room, because that doesn't always happen. And so it's great to just kind of be a part of a conversation where we can hear different perspectives that we don't always get from the other groups and coalitions that we're a part of that might be focused just on kind of a single aspect of what's going on. So I just wanted to throw that out there and say that, even if you're kind of tangentially, related to any of these programs, that perspective is still really valuable and important, no matter how you interact with them.
Thank you, Julia. And I do see Bill here, and he and I had been speaking the other day, so I'm not putting him on the spot.
Sorry. I found last week's meeting to be really interesting. I'm very passionate about this, so whatever I can do to help, just let me know.
Thanks so much, Bill. All right, I'm just going to take a quick look, make sure there aren't any hands up or anything from folks who want to say something. I don't see it. But yeah, feel free to include something in the chat, and we are happy to keep everyone engaged. Thanks so much. All right. So we are going to move on to our presentation section of the call, and we're going to get things kicked off with Julia Gross. And I don't know if Karen is here, Julia. I didn't see her in the list, but Karen, if you're here, let it be known, and I will.
Yeah, so I can kick us off. I know Karen is planning to join us, so hopefully she'll be on in the next few minutes or so, but I think.
Okay. Julia, let me know if you would like to share your screen, or if you at any time would like me to share my screen with the graphic of your data. I'm happy to do whatever works for you.
Okay, great. Yeah, I think I can pull up my screen. Also happy to put our website in the chat if screen sharing is distracting to people and anyone wants to have the report up on their own. So like I said, my name is Julie Gross. I am with Maryland Hunger Solutions. I'm the Senior Anti-Hunger Program Associate for Child Nutrition Programs. And I'm here to just kind of briefly touch on a resource that we've put out over the past couple of years, but have updated recently. Our county hunger profiles. So I'm hopeful that Karen will be able to make it in the next couple of minutes, because this is a resource that has really been led by our research interns. It's been an opportunity to get our interns involved in some of the reporting and the data that the state has put out, and really create a fantastic resource for anyone who is interested in kind of looking at the programs all together. So we started this, I think pre-pandemic. Someone who has been following this can correct me if I'm wrong. Time is a little tricky these days, but we kind of saw a space, particularly in our work, looking at all of the kind of federal nutrition programs together. Saw a gap where there wasn't a place where all of the data for all of the programs were together, and looking at Maryland statewide and also county by county, really seeing an opportunity for a piece like this to kind of bring those program numbers together and really look at the trends as they kind of work together as a whole and change over the years. So I am happy to pull up, let's see, let me pull up Montgomery County's page right now. Or
And
maybe
I did include that in the chat, so
okay,
great. Have it up in front of them. Yeah.
I'll actually start at the beginning here. So these are the profiles. There's a little introduction on some kind of a little description of some of the programs, and a trend. So looking at particularly SNAP participation, and how that's changed over the years. And I think we pulled this because it's a really great indicator of kind of how food insecurity has changed over the course of, you can see 2013 to now 2022. And so just kind of looking at that graph, we obviously know that there's been a big shift because of the pandemic, but looking at SNAP as an indicator of that, kind of seeing that little decline there, and then that huge jump in 2020 when the need increased. So that's one of the indicators that we always look at in terms of participation, knowing of course that there are people who are still in need that aren't able to access these programs, and there is still a huge gap there. Even though the participation has jumped, there's still a lot of need that isn't being shown by the numbers. So I'll roll all the way down to Montgomery County, way down here. Here we go. Yeah, so just bringing together, like I said, numbers that, we use on a daily basis, kind of in one place. We see this as a great tool for whoever is interacting with these programs regularly. but also as a great education tools and advocacy efforts. So this is something that we've used and shared with legislators, particularly on the state level, to kind of showcase some of the numbers in districts that they might be representing. So, we have, population numbers, household income numbers, and then we go and look at the child nutrition programs, SNAP and WIC, kind of all on the same page here. So I'm happy to pause and answer questions about, anything that we've included. I'll also pause and see if Karen
your pause was perfectly timed, Julia. Karen just joined us. So.
Okay, great. Well, Karen, then I'll turn it over to you because I know that you have really led this iteration and the most recent updates that have happened. So I'll let you dive a little bit deeper into the data. And I'm also wanted to mention that we're so fortunate that Karen is joining us because she's been our research intern for the past, I want to say, year, and has unfortunately just left us. So she even committed to coming back a week after her final date. So grateful that you're here, Karen. Thanks for joining us.
Thank you for having me. I'm really, really happy to be here to kind of explain this a little bit more. This is okay that no schools are participating. So Mary's just asked a question on the chat. Why does it say that no schools are participating in community eligibility? Some counties do not participate in CEP, which is why we kind of, from the one last year, we didn't have this information on, but Michael J., who's also the director at Maryland Hunger Solutions, decided to include that because a lot of counties are, counties and also a lot of communities are eligible for CEP, but they do not apply for it. So that's something that's important that we thought we should put on here on this document.
I'm sorry, Karen, I'll just add to clarify on that. I don't see anyone from MCPS on the call, but if I'm missing you, please feel free to speak up. But I will just say that in Montgomery County, they do not participate in CEP, but MCPS has identified about a dozen schools that they do provide universal lunch at, and MCPS is covering those costs. So they still do want families to complete the farms forms at those sites because they are still getting reimbursement from USDA, but they're kind of covering, as I speak, Marla is joining us. They are covering those extra costs, for students that have not completed the form or are not eligible at those sites.
Correct.
If you don't mind, I'll also I can give a little bit more information about that too, just the way that CEP works. So the community eligibility provision is available for schools that have a high poverty percentage. So at least 40% or more of their students are identified as eligible for free meals without filling out that farms form. So that means they're participating in SNAP or TANF, or they're in foster care, or they hit a number of other eligibility criteria to be directly certified. So in a lot of counties, that number, or a lot of individual schools, because either groupings or individual schools can opt in, that number can be as high or nearly as high as the free and reduced price meal participation. In some counties like Montgomery County, we see a huge gap. So there might be schools that have incredibly high farms rates, like in the 70–80%, but that ISP number, the identified student percentage, is incredibly low. They might not even be eligible, just based on the number of students that are directly certified. So we're seeing, particularly in Montgomery County, a special case of very few schools hitting that eligibility threshold, even if they do have high farms rates, and the ones that do are hitting it at such a low percentage that it might actually be more financially viable for them to be reimbursed at the farms rates rather than the CEP rate, if that makes sense. I'm also happy to go dive a little deeper into that explanation for anyone who wants more policy talk. Sorry, Karen, I'll pass it back to you.
Oh, okay. I don't want to repeat anything Julia has said, so Julia, let me know if I'm repeating myself. But I guess we're just sticking with Montgomery County. The one thing that's kind of sets us back with the data that I was able to receive is that, as you can see, a lot of the population, it is from 2021, and also the information on this document, if you read the introduction and also the appendix, you'll see that a lot of the information that is on this document is from January 2021 to January 2022. So when I created this document, it was, well, updated the document, it was the end of January, early February. So that might throw things off a little bit, but the thing is that the participation rates are not super different. There's not much of a change. If anything, the participation numbers had changed by, let's say, 10, 20 participants per month, or they have changed by a couple hundred. So it hasn't been a crazy drop or a crazy increase. So that's cool. And also the poverty rates, they're still from 2019. Those numbers have not been updated for a very long time. I'm not really sure they've been updated now, but at the time where I updated these, the census has not updated them at that point. So obviously that kind of sets us back, like I said, just because of the, because of COVID, we don't really know how many people have actually joined the poverty, I guess, bracket. Or also, I was mentioning this to Anne Marie a couple days ago, we don't know how many individuals have passed due to COVID, and we don't know how that has influenced other people. So if anything, this kind of opens up the doors to many more questions, like how did this impact families, or, there's just a lot of questions that kind of come into this that could help you with the organization to say, like, let's do, like, ask research questions or look into it a little bit more. The beauty of it is that there is data out there. Now that people are starting to kind of look into it a little bit more, a couple months into 2022. For example, with the children with summer meal programs, there have been, I want to say, 2 or 3 papers that have come out of it, right, Julia? That kind of explain how COVID has impacted these participation numbers. And if you look at the Hunger Poll from last year, the thing that focuses the most is the 400% increase in participation with SNAP, and also with everything else. So there's kind of like, it's kind of like, it's a document that could really help, and also a document that could be more specific also. This is very broad, and like I said, a lot of the numbers are a little bit from a couple months ago, even a couple years ago. So that kind of, I think if anything, like the easy thing about this is it can be easily be updated, and it can be adapted pretty easily, especially because in 2022, with 2021, everyone has been adapting to COVID. I think that the most change that anyone can see with numbers or participation numbers or anything is from 2019 to 2020. Yeah, I'm not really sure what else I could say. If you haven't said anything else, Julia, can you share anything?
Yeah, so just following up in here, I'll stop sharing my screen so we can all see each other again. I'm just following up on what Karen said there. We have been following the summer food service program numbers a little bit more closely, so I can also pop a couple of policy briefs that we've created in the chat that I think kind of showcase some of the changes that have happened around the program. So I will say that's one thing that this report doesn't have. So it's kind of purely numbers, and we've collected what we can from what state agencies have provided to us, but it doesn't have a lot of the background information on what has actually changed and happened with the programs throughout the pandemic. So which is why I'm glad that we're presenting or having a follow-up presentation by the Capital Area Food Bank. I know they have a lot of info that in their report. but just wanted to flag that I think, seeing these numbers and the need, and of course, recognizing that this doesn't even represent, all of the need that is across Maryland. It only captures participation, not who is eligible and not participating, or who is in need and not even eligible for these programs. So just wanting to flag that this is a really great opportunity to then take this information and advocate for continued expansions to, remove the barriers from the programs that we all know can prevent people from participating. So I'll pop a policy brief in the chat that gives a little bit more information around summer meals and some of what we've found to be helpful changes and flexibilities over the past 2 years. But I'll also put in the chat a sign-on letter that we're circulating around child nutrition reauthorization, which I think is another great advocacy opportunity to see some of these great changes to the programs that we're all working with, and hopefully expand some of the eligibility and opportunities for people to participate in these programs. So with that, I will pause and pass it back to Anne Marie.
So first of all, I wanted to thank Julia and Karen especially for coming when she's no longer in her role and moving on to new and interesting things. And I wanted to thank you for your time. I really appreciate you being here and sharing that information. And I did want to highlight what Karen said about, and I think it's something we can all assume and we just don't really think about it. One, the challenges in terms of what does data mean moving forward when we're not even sure, how many people we may have lost or whose families may have been affected by that loss in terms of food insecurity and food access needs. And then also to the challenges of just collecting data during this time. So all of the organizations who take that on as a responsibility, what has staffing and, getting people to participate, in these counting efforts and in this data efforts, what does that mean for data moving forward? So, just some challenges to keep in mind. But I think together, I think it's safe to say that there's a lot that we're going to know anecdotally that probably is not going to be reflected in data, for the next couple of years, until that process all kind of smooths out and gets back to normal. And, I think this is a great time, like they were saying, to move into the Capital Area Food Bank's presentation, because, that was collected by them, not other organizations, that we're used to getting our data from. And, so they were in charge of that and connecting with individuals receiving services. So I think when we bring these two things together, they're actually a really nice complement to each other to get a sense of what the picture looks like in Montgomery County at this time. And I'm going to welcome Sabrina and Julia from Capital Area Food Bank. And Sabrina, I believe I made you a co-host, so you can share your screen whenever that works for you. But thank you so much for joining us today.
Yeah, I think I also, because I was a co-host, had some privileges to click remove on a few people really quickly. So I got your back.
It's a team effort. Thank you.
Yeah, absolutely. Okay. Well, thank you so much for inviting me. I'm so happy to be sharing this with you all today. Some of you may know we published this report several weeks ago, and what I'm going to do today is tell you a little bit about the report, our methodology, and I've culled some of our findings specifically for Montgomery County, including some that weren't published in the main report, in the hopes that this is useful information to you. I've also thought of a few discussion questions that maybe we can use to get some conversation going, and I invite you to interrupt me as I go through and let me know if you have any questions about the data you see on the screen or the report in general. So you can pop them in the chat. I'll try to be good about watching that. Or you can just come off of mute and let me know if you have a question. And before I start, I'll put a link to the report in the chat. Okay, so some of you may know this is actually the third hunger report that the Capital Area Food Bank has released. We had the idea before the oh gosh. I didn't write that.
I'm sorry, and I had just disabled the chat, but I will find a few other things to do.
Yeah, let me stop sharing and reshare.
Yep.
This is funny.
Mm.
Right, so 300 reports. The first one that we published, we originally conceived of it before the pandemic, thinking that, some similar thoughts to what Julia said. We saw a lack of data on really the dimensional issues of food insecurity in the DMV. And so we wanted to pull all of that together in one place and provide a picture of what was going on at the client level. Sorry, guys, I'm gonna take a
I'm
pause.
sorry, I just changed all the security settings, but I don't know if they just hadn't taken yet by time that happened. I'm gonna keep looking.
Okay. Should I just keep going, y'all?
Please.
Okay. All right. So yeah, we're about to publish the report. The pandemic broke, I think, a month before we planned to publish. Obviously, we stopped, reassessed, and subsequently, each report that we've published has really centered on the impacts of the pandemic on our clients and their food security status. And a few things that are unique about this year's report. So in the past, we have gathered public data and repackaged it just for our region, or we've gone straight to our clients and done a survey with attendees of food distributions of our partners, some of whom I know are on this call, and featured their responses in a survey. This year, what we did that was a little different is we partnered with a world-class social research institution called NORC at the University of Chicago and conducted a general population study, which means we were able to collect a representative sample from every single county in our region. And that allows us to make conclusions about what's going on with regard to food insecurity and other dynamics, because we can say we have a representative sample of the region. And that's also going to be important for this last point here, because we employed the USDA's screener for food insecurity. And one of the biggest headlines from the report was the prevalence of food insecurity in the region. And so this was the #1 headline. I'm going to walk through a few headlines across the region, and then some that are Montgomery County specific, and I'll try to do a good job of articulating when I'm talking about a regional stat versus a Montgomery County stat. But this is the first big one. 1/3 of the region experienced food insecurity at some point in the last year. So the standard screener that we use asks about the 12 months prior. We administered it in February this year, so functionally we're talking about the majority of 2021. And 33% of the population screened as food insecure, and about half of those screened as severely food insecure, which translates to over 1.2 million people not knowing where their next meal was coming from at some point. And here I have a breakdown of each county, and you can see that Montgomery County, which is the third level or the third bar here, had rates of food insecurity that were similar to the regional average. Whereas I think it's worth calling out, our neighbors in Prince George's County were at a rate of nearly 1 in 2 households having experienced food insecurity in the last year, which is just unacceptable. All of these rates are unacceptable. And so naturally, our approach has always been client-centered and data-driven. So we want to dig a little bit and understand who we're talking about here. So these stats show the composition of the food insecure population compared to the food secure population, right? So some of these are not surprising to those of us who work in this space every day, which is all of you. And the first one is the racial composition of these two groups. I mean, when we look at the historic systemic racial inequities that have affected our region, it's not surprising that 43% of the food insecure population is Black, 26% is Hispanic, 16% white, 13% other. Whereas if you come over here to the food secure donut, 52% of the food secure population is white, only 21% Black, only 10% Hispanic, and 14% other. Another statistic, we've been talking a lot about child food insecurity today. Of the food insecure population, 48% had children at home, compared to only 24% of food secure households. And one thing that's worth noting, I don't have it on the slide here, but when I was showing this to our CEO, she said, I want to know what happens if you put these two together. Can you find the statistic for households of color with children for the region? And when we did that, the statistic became 61%. of households of color with children in the region experienced food insecurity in the 12 months before this survey, which again is just shocking and extremely high. Okay, so this is the first slide I have that's specific to Montgomery County. These are some of the questions that comprise the screener that I've been mentioning that the USDA administers. It asks questions like, has this happened to you in the last 12 months? My food just doesn't last before I have money to get more, or I couldn't afford to eat balanced meals all the time. I had to cut the size or skip meals because of money. And you can read the rest of these. And when I took a deeper dive into the Montgomery County data, it was really clear that households with children had much higher rates of answering yes to these questions than households without children. And you can see that on the screen. So I know that child hunger is a strategic area of focus for this group, and I wanted to offer this data to you just to prove the point that it is worth focusing on households with children because of these statistics. They're more vulnerable to food insecurity. Another one that's Montgomery County specific here is why? Why is this happening? Why did this happen in the last year? And a lot of it comes down to employment impacts and financial impacts of the pandemic. So the first chart on the left here is how many Montgomery County residents experienced these employment impacts. I was scheduled for fewer hours. I had my wages or my salary reduced. I had to take unpaid time off. I was laid off. I had to quit my job. And you can see the numbers here, which are all really high. Then financial, a lot of those employment impacts lead to financial impacts. How many times was it the case that a respondent was unable to make rent or a mortgage payment or pay their credit card bills or apply for and receive unemployment or not pay another bill? And you can see, again, these numbers are just really high. And so that's behind what's going on. And again, when I took a look at the households with children versus without children, it's really interesting that the employment impacts were significantly worse among households with children. So it was more common for respondents to have been scheduled for fewer hours, had their wages or salary reduced, or quit a job if it was a household with children, which is, again, and there's been plenty of coverage of this. I know that my conclusions here are not brand new. The pandemic was harder on households with kids, but the numbers here from Montgomery County just clearly reinforce that. The next thing that I took a look at is utilization rates of public programs among low-income Montgomery County residents. And unsurprisingly, these are all really low when you think about the fact that the denominator here is low-income residents. So government health insurance means Medicaid, Medicare, Social Security, SNAP. Only 16% of low-income residents in Montgomery County are receiving SNAP. We've done other work where we've tried to model the eligible population. I know that low income does not always equal eligible for a variety of reasons, but regardless, this number is really low. Another way that we cut the data from our survey was to look at people who screened as food insecure, and only 21% of all of them are receiving SNAP. So any way you cut it, the numbers are just really, really low for people who we know are struggling financially or as it relates to food insecurity. And these other numbers are also just, it's money being left on the table. A lot of these are entitlement programs, and we know that connecting our clients with these resources is incredibly important. So I'll take just 2 slides to share what the food bank is planning on doing with some of this information and the recommendations that we put out in the report for all sectors. And I have those discussion questions that I mentioned. So for us, we knew even before we collected this data that the first and hardest hit in the pandemic were going to be the last to recover. And it meant that we are not going to be returning to our pre-pandemic food distribution levels anytime soon. We're still at over 75% higher rates of food procurement and distribution to many of you who are our partners on this call. And like I said, that's not that we have no plans for that to dramatically drop. Even at the time that we collected this data, inflation hadn't really become a huge issue. And obviously it has since then. And whatever gains people may have experienced in employment from the pandemic's waning economic effects were just replaced by inflation in many cases. So like I said, our food distribution over the next year will remain elevated. The next thing is we have been seeding many different pilot programs to lift our clients out of food insecurity, meaning designing programming that addresses the root causes of their food insecurity so that they don't remain in the position that they're in. And one example that comes to mind is we're partnering with Montgomery College, the community college in Montgomery County, to help students who are in a particular scholarship program, and they're getting home delivered groceries from the food bank every other week. And we're trying to measure the impact of that on their graduation rates and their GPAs and their enrollment rates, how many classes they take next semester and things like this, because we know that if we can help folks increase their income potential, then they won't remain in the position that they're in. So that's just an example of a program that we've been piloting, and we are only going to be doubling down on this because the economic resilience of our clients is just so important. And the last thing, Julia Lemp can speak better to this than I can, but advocacy for a variety of different things. I already mentioned utilization of public programs, but we have a whole advocacy agenda because we know that our work alone is not going to solve hunger, and it's just so their government can do so much to address these issues as well. So our advocacy department has been growing, it's going to continue growing, and that's a big strategic area of focus for the food bank. Last, those recommendations that I mentioned, we tailor them to each of the three main sectors: the private sector, public sector, and social sector. And I'll just touch lightly on each one and maybe emphasize the main thing. The main thing for the private sector is they have control over a major lever for reducing food insecurity, and that's the types of jobs that they offer. One statistic that I didn't share in this report was that our clients are employed at the exact same rate as the general population. So if food insecure people are working, they're just working low quality jobs that are not helping them put food on the table, or they're working multiple part-time minimum wage jobs. And what we say to the private sector in the report is we were told by these clients in the survey that paying a living wage, offering them paid leave so that they can weather the normal storms of life, like having a baby or having a sick family member without having to take unpaid leave, and investing in their upward mobility so that they don't remain a field worker or a frontline worker for 20 years. Those types of things are going to make a huge difference in the financial health of our clients. That's what they told us in the survey. And so we say to employers, your decisions here can make a huge difference in so many people's lives. So think hard about the way that you design your compensation philosophy and all of these benefits choices that you make, et cetera, et cetera. Then to the public sector, we talk a little bit about tax credits. We talk a lot about utilization of public programs, which I've already mentioned, and expanding eligibility for programs to include more people who are in need. And then finally to ourselves, you know, take the mirror on to ourselves in the social sector, and really all of us on this call, it's what can we do to make it easier for our clients to navigate the complex web of social services that exist for our clients. And sometimes we've seen co-location be really helpful, meaning literal physical co-location of services in the same place so that people are not taking multiple buses or time off of work to trek from office to office to get support. Referrals is also like a healthy referral system where you know a whole list of resources that if maybe they're coming to you for one thing, but they may indicate that they have other needs as well, and knowing where to send them for that support. And when possible, literally integrating the programming, partnering up with other organizations to design synergized programming. Like, for example, we've partnered with Children's National Hospital, and when children who are pre-diabetic or type 2 diabetic go in for a clinical appointment and they screen as food insecure, the doctor sends them downstairs to the food pharmacy that's stocked full of produce from the food bank, and they leave with like 30 pounds of produce, like on the spot. So if there are two issues, how can you address both of them at the same time in a way that, like I said, synergizes the two impacts and maximizes them? So that's what's in the report, a high level. There is more, and you can check it out if you want to read the whole thing, but I was thinking and talking with Anne Marie beforehand about what we can discuss about this here. And so I wanted to save a little bit of time. Anne Marie, is the chat open or are we not doing that?
So the chat is currently not open. And
Okay.
I think what I like to see, which I usually don't, but what I like to see now is that we have fewer participants than we did when we started. So I'm hoping that
Yeah.
those
Maybe
were guests, those were visitors who left and not our usual guests. So I think maybe what we can start with is maybe raising hands, if people want to verbally engage, and, I will unmute you and we'll take it from there and hope for the best.
Sweet. Now I'll say up front, the two meatiest questions are number 2 and number 3. But I would be open to hearing anyone's responses to any of them. I don't want to be too prescriptive here. And 2 people have already raised their hands. So Anne Marie, I'll let you control and kind of
Great,
facilitate this
great.
then.
All right, we're going to try with who I am assuming is Judy Clark.
Great. Hi, everybody. I tried to show my lovely face, but the host disabled me. You hear my voice, and thank you so much for these presentations. One of the things that I really zeroed in on was number 2, what is being or can be done to increase utilization of public programs. We get many, many clients that inform us that they are not receiving the SNAP. And we ask them why. And they always come up with a story that we kind of think may not be completely accurate. We have identified that one of the major reasons that our clients aren't tapping into the SNAP is because they just don't know how to do it. It's more cumbersome than they think. So what I was thinking a viable solution is, we can do everything from incentives, like give them a gift card to do it, or again, urge them to, that we do it for them. The clients that are willing, we sit right there in the facility and help get them through that first stage. But sometimes it's like, we've bought birth certificates for people who didn't have birth certificates. There's a lot of things holding people up. And they'll say that they didn't qualify, but they're not telling you why, that they needed birth certificates or social security cards. So I know we're all busy and I know many people do this, but I would say one of the biggest things we can do is to encourage them that it's not cumbersome, that we'll handhold them through that process, but also get to the nitty gritty and find out what missing document may be holding them back from those, food stamps, from getting that SNAP, but also offering some kind of incentive, something pleasing that they would like, that would make them sign up.
It's a great suggestion. Thank you.
Thanks, Judy. I'm going to go to Mary Bennett.
Okay, I was also going to ask about question number 2. I know that there are a number of things being done in our county to try to increase the SNAP, people getting SNAP. And I know that people have gone to some of the apartment buildings where there are a lot of seniors and help them sign up. I know that they've, Manna Food helps people sign up if they're not already signed up, but what else can be done? Is there anything in the works that the county is doing, the county government, or are they just leaving it to the nonprofits?
I'm not sure I'm the right person to answer that question. That's a great question. I don't know your name, but I can tell you want to answer the question.
Sorry, it's Elizabeth. I forgot that I don't have my name in there. I just wanted to say sort of a plug for our SNAP work group that's run out of the Food Council. And we are a group of community-based organizations in the county that do that SNAP hand-holding, because while it should be an easy process, many not. We find many of our county residents are experiencing a technical divide. There are, frankly, a lot of issues with the application process. So there are a group of organizations in the county that are specifically here to do that handholding. We have access to the online platform. We can do applications over the phone. We can help people with all of the documentation that is necessary. And this is just a plea, really. If you're interested in helping the folks that come to your organizations for food with accessing SNAP, come to our SNAP work group and learn how you can sort of be part of the process. We would love to partner with folks to get referrals, to help educate, to really show you what the system is all about so that you can help those folks as well. And so we welcome any and all to join us. We meet the fourth Tuesday of each month. So August 23rd is our next meeting at 2 o'clock. And we really do welcome any and all who are interested in SNAP to learn more about what is going on in the county and what more needs to be done, because there's a lot of work to be done there.
Sorry, pressing my wrong buttons. Joan Conway.
Good afternoon, everyone. The population that we serve at St. Camillus is largely immigrant. And there is this caveat that says you can't apply for citizenship if you've ever been reliant on the federal government for support. And although it's their children that are getting the food stamps, many of our families won't sign up because they don't want to have it on themselves that they applied for support from the government. Because about probably 10 years ago, the Capital Area Food Bank came out and we trained about 20 people and we started educating people, but we got nowhere.
Yeah.
Thank you.
I've also heard of even people who may have a green card or may be a citizen, but reside in the same home with someone who's undocumented, being worried about applying for compromising the status of someone who lives in their home.
Yeah.
So it's you're right. It feels very threatening.
And the USDA food, I forget the name of it.
FNS.
FNS, the people who oversee the food stamps, they have told me personally that they'd never share the information with ICE or anybody else. So, in fact, I think there's some kind of legislation saying that they can't do that. But it still doesn't, calm people down.
Could I just jump in quickly and address that as well? So I recently attended a webinar by a group that did a lot of studying of messaging to help with immigrant communities and what best helps them learn about what you're talking about here, the public charge rule, and really overcoming a lot of the barriers and misconceptions and fear that's out there. So I'm going to share that with Anne-Marie so she can share it with all of you, but it is still a real fear. And one of the things that they suggest mentioning to folks is to really name names and say, you know, the Trump administration was trying to do this, but it is over now and it is safe, at least, you know, for now. But yeah, so name names, folks.
And I will be sure I'm getting some requests in the chats that I can see for information about the SNAP work group that Elizabeth mentioned and how to get in touch with her. And again, I will share that all out in our follow-up resources email tomorrow, just to try to limit anything that I'm not entirely sure is a legit email that I may be getting. But thanks so much for your patience. And thanks, Elizabeth, for sharing all of that good information. Okay, Griselle Velez.
Hi, Griselle Velez. I also want to show my lovely face, but the host does not allow me to. Griselle Velez, I am from Catholic Charities, and I love hearing the fact that there are people out there that they are in need of assistance, of the SNAP program assistance. I am the program manager for this program, and we have case managers that they are located at different hubs. Right now we have about 6 hubs. We have the Youth Hub, the Oak Chapel, Harvest, Clifton Park, Seneca Creek, and Kingdom Fellowship that we're gonna start working with them. We have case managers there. They are there during the distribution dates, and they are there in other days of the week. They are there to do outreach to find out who is in need of the SNAP program, who needs questions to be answered in regards to the SNAP. So if you have anyone that you think that they are in need of the SNAP, feel free to just refer them to one of those hubs, or just refer them to me. I can share my my email information. So whomever is in need of more information, just feel free to contact me.
Thanks, Griselle. Grace?
Can you hear me now? It would not let me unmute.
Yes, sorry. Thank you.
That's okay. I'm good. Just wanted to go back a little bit to the public charge, because in fact, we just had a case where one of our clients was very adamant about asking us and having some documentation to show that this was not going to affect her because she's applying for citizenship. And this is also not just in the Latino community, but the Asian community. They're also very, very fearful about applying for any programs. So we actually have a letter that you guys actually gave us with the SNAP Food Program, which is signed by the Secretary of something, but we translated that letter also into Spanish. But what I was going to ask is if, I know there's some folks here from HHS, we actually had worked really diligently in the summer of 2019 among the 3 minority health initiatives in HHS to actually have a statement that was going to be done by HHS for each client that went and applied, either for rental assistance or food stamps or anything else. And it was going to be giving out in different languages to the community to let them know that this was not going to have an direct effect on them. I think we should revisit that. I know we worked on a document. I know that we met several times to work on the language. And that was directly with Dr. Raymond Crowell and some of his staff. But I think that would be extremely helpful, but because that's like this black cloud that's still there, that just, it's a fearful thing that our communities that we deal with still have a lot of questions about. So if we could revisit that, that would be great, because I think a lot of folks, because not everybody is, is going to know about the hub or about Catholic Charities, but a lot of people go directly to the eligibility centers in the county. And if we can have it in different languages there, and if they can share that with us as well, I think that would also relieve a lot of that tension that people have and hesitation. Thank you.
And I'm sorry, because I can still only see a few folks because of the screen sharing, which is totally fine. I just want to make sure. Deanna, was there, anything you wanted to add, since about that letter, since, it had come out of DHHS, and no pressure to do so, but I just wanted to give you the opportunity if there was anything you wanted to say.
Thank you, Anne-Marie. Nothing to add at this point. Appreciate it.
Okay, great. And again, I certainly don't want to minimize, we know obviously what should be happening currently, and we know that it should not be a concern, for any of our residents. But unfortunately, I feel, like we are all in the very difficult position to acknowledge that, what is fine now, could change under a different administration. And so I want to, be mindful of that fear and not dismissive at all, because, we just, like I said, we just know things change. And that was something that was kind of crafted and used in a way that, hadn't been considered for, many, many years. And so we just don't always know what surprises might come our way in the future. So thank you for sharing that. Grace and Mary, I still see hands up. I wasn't sure if you had something more to add, Mary. Okay, yep.
I just had a question with the new, and I'm probably going to get the exact name of it wrong, but the new Food System Resiliency Office in the county government. Would that be one of their goals to coordinate and increase SNAP participation throughout the county? I mean, could, or should it be one of their goals if it isn't?
I don't think I can answer that question either, unfortunately, but I just saw Julia raised her hand.
Oh, so, yep, I'm gonna unmute you, Julia. Sorry, just getting through. There we go. Yeah.
So much. Mary, I just want to speak to that a little bit. That's something that the Capital Area Food Bank advocacy team has been encouraging of, and not just SNAP participation, you know, participation in multiple different social safety net programs, because we know that, you know, SNAP and hunger, though they might be most aligned, it's not a completely comprehensive view of all of the reasons why people experience food insecurity. So that's something that we've been in discussion with you know, the council and the county throughout this process is, you know, the potential for this office to have someone focused on synergizing these utilization efforts. Something we've been advocating for, not saying that that's the direction it's going yet, or that I have any information on that, but just wanted to add that that's something that our advocacy team has been very supportive of and working on.
Thank you.
Anne Marie, looking at the time, maybe now's a good time to transition over to Julia.
Yes, and thank you so much. This is just, you know, we're having a great conversation and I never like to cut those things off. So I'm going to suggest two things. So it's 2:09 and we've got some security limitations with us today. And I know we still want to hear from Julia. And I know that Gabby Massey from Capital Area Food Bank also had something to share. I am going to suggest that we put off our community conversation about funding, because I just feel like we're not really going to be able to feel comfortable engaging, you know, on this call at that level about, you know, what is a sensitive issue. So if that is okay with everyone, I think, you know, Julia can take her time sharing what she would like to share with us. Gabby can do the same. I'm happy to then open, you know, the floor as best we can to any just community announcements that you'd like to share. I'm happy to introduce people that we haven't met before who are supposed to be here. So I'd rather use this for, you know, kind of safe, productive time than moving into a conversation that, you know, like I said, we're not really going to fully engage in. So Julia, that all being said, please, I will ask you to unmute again. Sorry, I have to get rid of all these little messages that keep popping up on my screen. There you go.
Fantastic. Thank you, Anne Marie. And you can tell me no, but could I share slides? Is that okay real quickly? I will need your permission, but fantastic. Okay, here we go. All right, folks. Hi, everyone. Thank you all so much for bearing with us. Huge shout out to Sabrina and Julia and Karen and everyone who's been presenting despite this, you know, this trouble. So I am Julia Lemp. I am the Advocacy and Public Policy Specialist at Capital Area Food Bank, and I am here to talk to you today a little bit about our Client Leadership Council. So you've gotten some great information about a lot of the work that we have to do as advocates in the anti-hunger space, and the Client Leadership Council is one way to kind of go about this. So I'll give you a little bit of background and then ask for your help in building up this Client Leadership Council. So when we talk about the Client Leadership Council, or the CLC as we call it, the CLC is a 10-month advocacy training program for about 24 folks across the Capital Area Food Bank service area. So that of course includes Montgomery and Prince George's counties. That includes the entire DC region and then Northern Virginia. So we gather about 24 folks in our service area who are currently facing food insecurity for this 10-month training program to better their work as advocates. And really, we put together the Client Leadership Council because we have long experienced the fact that our clients are not always in the room for the decisions that are being made that affect their lives. You know, we've been in service as an organization for 40 plus years, and we really want to make sure that client voices are at the center of everything we do. Sabrina said it, client-centric, data-driven. So that is kind of how the Client Leadership Council was birthed. The Client Leadership Council is really meant to provide these clients, these 24 folks who go through the program, with a toolkit to enact change by lifting up their story of self. So we take a really, centered approach on focusing in on folks' story of selves and their lived experience. So the first, about third of the class is really centered on building up these stories and empowering folks to use their lived experience and to know that that's something that holds weight and can be influential and should be influential. And then we really focus on 3 areas where our clients have been historically underrepresented, which are policy, press, and programming. And these are kind of the 3 areas where we really want our clients to lift their voices. So on the policy side, clients are encouraged to get involved with some of the advocacy work that our own advocacy and public policy department is doing. So they get involved in our advocacy agenda, join us for meetings that we already have scheduled with council members or representatives or whomever it may be. But we also allow clients to kind of pick their own advocacy direction. So if someone has a particular interest in any area, relevant to their lived experience, we're really proactive about lifting up kind of their own policy voice in different arenas. And then press. So we use kind of our own connections with national and local media outlets to ensure that our clients' voices are being lifted in different press stories and opportunities throughout the course of the class. And then on the programming side, clients get input into kind of how the food bank does its service. So around the time that we are crafting our annual operating plan as a food bank, clients get to provide insight into some of our programs, some of the ways that we operate, and get to influence kind of, what our year ahead looks like. So how this is all done, clients go through, again, this is a 10-month program, and every month we host a skills call, a different training with an expert from across the region, focusing in on things like building up your story of self, or media training, public speaking, providing testimony, a variety of different things. We have 3 in-person convenings, which are day-long kind of skills trainings, essentially. So opportunities for folks to hear from experts throughout the region. And then, of course, we work very closely with our members as a staff. We connect folks with different community advocates throughout the region, different other organizations that they might be interested in getting involved in, different policymakers, to really make this an impactful experience. So all of this to say, we are about to enter our 3rd class. So we have run through this program twice with 2 different classes now. And there have been some just awesome experiences, awesome wins. You can see that we've had folks meet with Vice President Harris and President Biden. We've had folks speak on the Hill alongside Congressman Jim McGovern, who's the co-chair of the Congressional Hunger Caucus. We've had folks featured in our hunger reports that Sabrina just spoke about, testifying in front of their state legislatures. Everything you can think of, our clients have really stepped up and made their voices heard in these arenas. So, like I said, we are heading into our 3rd annual Client Leadership Council, and I'm really here today to ask you all to nominate clients. I know that many of you work on the ground or have relationships with folks who might be a good fit for this program. So again, I guess in the follow-up, I can drop our website link and the forms to apply or nominate folks. And Anne-Marie can send that out later. But really, we want, as many folks involved in this program as possible. So we know that you all have those connections, and we really want to encourage you to nominate anyone that you think is a good fit or pass along the link to apply. So you're more than welcome to contact me, visit our website. We'll pass around that information. But CLC, we love it dearly, so we want you all to get involved. So thank you.
I see Grace's hand up, so I'm just gonna ask him to unmute. There we go.
Thank you. Thank you for such a great presentation. I was wondering, the folks that I have in mind, they're mainly Spanish speaking. Would you be able to accommodate that?
Yep, that's a great question that we've gotten a few times. So we are working on translating our workbook into Spanish. So we'll have the options for an English or Spanish workbook that folks can work from. Currently, things are being hosted mostly in English, just given our capacity, but we are trying to make this program as accessible as possible. So Grace, feel free to connect with me off the line and we can chat a little bit more about that.
Yeah,
Thank you for the question.
Happy to help you also with that. And what is the time commitment?
Yeah, That's a great question and something I definitely should have mentioned. So again, this is a 10-month program. We estimate that folks throughout the course of the program spend about 5 hours per month on the class. And importantly, we do pay folks a living wage stipend. So it's about $30 an hour for their time commitment in the class. And we do cover any transportation costs to and from events or, opportunities. So it's about a 5-hour a month time commitment we estimate, give or take based on what's going on in that month.
Are there any other questions for Julia? Okay, thanks so much. Oh, Ray's got another question. Hold on.
So sorry. I'm so sorry. Just, is it through Zoom or in person for the time commitment? Sorry, I should have asked all together, but do you need the person to be there in person or could it be through Zoom?
Another great question and something that has varied throughout the pandemic, right? So typically we hope to have our skills calls all be virtual. So that monthly skills call would be virtual. And then the 3 day-long convenings would be in person. Again, based on health and safety standards, that might shift around a little bit, but we do hope to kind of have that mixed hybrid opportunity for folks to be involved.
And most of these are in the evening or afternoons or, okay, awesome.
Yeah, well, that depends on kind of the makeup of the class. So we pick together once the class is assembled what works best for everyone. So it's kind of varied throughout our past 2 classes, but we try to make sure it works for the majority of folks' schedules.
Now definitely I do have a few folks for you.
Yeah,
Okay.
please pass them along and reach out to me by email. I'll send you, or I guess Anne Marie can send the links and everything. It's on our website as well. So just stay in touch.
Stephanie had a question. Oh, where did she?
Okay,
Oh,
I
there she
got it.
Yep.
Is there a cap of how many people you're accepting for the program?
We typically accept up to 24. If we have stellar applicants, that might be negotiable, but we try to keep it at about a 24 person class. Just really throughout the class, we build such a community as a group, and having that small group, kind of allows folks to really open up, share their stories, feel comfortable asking questions, things like that. So we aim for about 24 participants each year.
Great. Thanks so much, Julia. And continuing from Capital Area Food Bank, I'm going to share the floor now with Gabby.
Hello, everyone. Yeah, sorry, my camera is not working also.
I'm sorry. No, it's the locks from.
It's a lock. That's
Yeah.
okay. Well, thanks, Anne Marie, and thank you all. No, just wanted to quickly share that our direct distributions team at Capital Area Food Bank has an opening for 5 mobile markets in Montgomery County. So wanted to let this group know about them. The mobile markets is a program that we offer. It's basically a produce program that occurs once a month, and Capital Area Food Bank provides the food, but it is required that the community or the organization runs it and distributes the food. So we do require a commitment from the organization. This is not a program open to our current partners. This is meant to be to serve those gap areas where there's no current really distribution of food. And so it would be, if you know of maybe perhaps already organizations such as social service agencies, places of community centers that are already servicing the community, this could be a supplemental program for that. So if you know of an organization or you're interested, please reach out to me, or I'm also going to provide this information to Anne Marie, and you can either reach out to me directly or to our mobile market specialist, Kayla Polly Nelson. So I'll share her information as well. But wanted to make sure you all knew about this. So it's 5 mobile market spaces in Montgomery County that we have available now.
Anyone have any questions for Gabby? Gabby, Julia, Sabrina, thank you so much for hanging in with us today and for those great presentations and information. And like I said, we will definitely be sharing everything out tomorrow. Since we have 8 minutes, I will share that we are already working on the topic for our September call, which is going to be food waste and food recovery. And I have invited folks from Montgomery County's Department of Environmental Protection to come and talk to us about, campaigns that are rolling out now aimed at residents about reducing food waste. And I thought it would also be helpful, for them to come and share our ideas with us as to, what ideas are helpful for food assistance providers in that area, what information can we help share with clients, to help them reduce household food waste. And then we'd also like to have a broader conversation about reducing food waste through food recovery. And so, we'll be looking to engage with food assistance providers who are already performing this service, ones who have questions about it, the different scales of it that there seem to be going on in the county. So, please do join us in September with new and improved security controls that I will research between now and then. We look forward to seeing you there.